Hello, everybody. I feel very honored to be here today with so many esteemed guests. I was asked to speak along with my manager, Maureen Leahy, who unfortunately cannot be here today, about palliative care and hospice. Many of you who don't know what hospice and palliative care are, they sort of get confused. Hospice, as many of you know, is for patients that are critically ill and on their deathbed, dying, and they have a prognosis of about 6 months or less. Palliative care, on the other hand, which I fell in love with as well, is a holistic way of delivering care at any point of your illness. It could be, I asked for a palliative care consult for my sister who just recently fractured her ankle. Not only do we manage symptoms, we do 3 things. We relieve, we communicate, and collaborate. We relieve symptoms, pain, nausea, vomiting. We communicate with families and we collaborate. On our Wiener Family Palliative Care Unit, which we also function as a hospice unit as well, we work with yoga therapists, art therapy, pet therapy, masseuse, nurses, doctors, physicians, social work. We work all together to coordinate, and art therapy to coordinate to give a holistic experience for the patient. And so I actually fell in love with it because I used to work in a medical surgical unit, and then I transferred to the CCU. And what I really love about palliative care and hospice is that I'm able to care for someone on a very holistic level. So, that being said, I'd like to share with you some magic that happens on our palliative care unit. So I was assigned, and somehow miraculously, nothing happens miraculously, but I was working for 5 days, one after the other, and I happened to be assigned to the same patient. And I'm sure, as many of you can relate, you start getting somewhat emotionally attached to them. So this started happening, and I started noticing that. As the first, I'm going to refer to this patient as this Miss AY. So Miss AY comes in, she's suffering, she's alert-oriented times 3, but the reason why she comes to us is because she's in a lot of pain. She's got nausea, vomiting, she hasn't been eating for a couple of days. So her diagnosis is stage 4 gastric cancer, and we know that she's almost going to be on her way out, though she's alert-oriented times 3. So the wonderful thing about palliative care is that not only are we able to alleviate someone's symptoms and help them physically, but also emotionally and spiritually. And you'll see how it sort of comes through from this story. So as I first met her, I introduced myself as Sneha, and it was lovely to meet her, and we started developing a routine. And the routine was, if she's sleeping in the morning, I wouldn't say anything. I'd write my name on the board and, give her morning meds, AM care with my nurse's aides. And she loved this massage with this aromatherapy lotion that we have. And she went to massage therapy school, so she's the one who taught me how to give her a really gentle massage. And so every day, it was a routine. We would give meds, AM care. She'd, as we were giving her a massage, she'd fall right to sleep. As time went on, we developed even a closer relationship, and we would do some breathing exercises together, and she would tell me about all the anxieties that she was going through. She told me that she hadn't really told her kids who were 10 and 12 years old that she was dying. She said to them, Sneha, I just told them I went to Mexico and I drank some water there and something was wrong with me. She was on a PCA pump, which is basically a pump with narcotic medication to alleviate her pain and anxiety. But when the kids came to visit, she was in so much pain she wouldn't press because she was afraid that that her kids would see that she was in pain and not her. And so she told me that she wanted to, share with them, but she just didn't know how. And so we got the art therapist involved, and her name is Sarah, and she worked with her. And eventually, slowly, she ended up telling her children. During this process, naturally, I started becoming attached to her, and every morning I'd give her medication, give her AM care, give her a little massage, and she'd fall asleep, and her lunch, and whatever. As time went on, it was the 5th day I was caring for her, and time took its toll, and so did the cancer. I started noticing that her abdomen was getting grossly distended. Her lymph nodes were getting very swollen, and she was getting very lethargic. Now, as many of you might know, that when someone is approaching death, they become very lethargic. And that's one of the signs and symptoms, and I know this was approaching. As I was educating the family about some signs and symptoms, I reassured them that I was there if they needed me for support. And this was my 5th shift, and it was time for me to go home. And so I went, and the last sense to go is hearing. So I went and I said, "Miss A.Y., it was lovely caring for you today. I'm going to be leaving." I didn't expect her to open her eyes, but she did. She opened her eyes, and she profusely started to cry. And she said, "Sneha, I'm really afraid to die." As she said this, her room was surrounded by brothers, sisters, nieces, nephews. As she looked at them, and she said, we listened intently and tried to be as present as possible as she explained herself in her intermittent periods of lucidity, and she said, "Who's going to care for my children? They're 10 and 12. Who's going to give them the love and affection of a mother? They're going to be motherless." As her brother was holding her, he said, "Don't worry, we're here. We're going to take care of them as our very own. Go peacefully." Then she went back, as we gave her a little massage to soothe her, she went back to sleep. As I stood there with the family, I was further educating them about, these are the signs and symptoms of death, and you're going to see this more. You're going to see that she's going to have decreased urinary output. Her mouth will become dry. You'll see she'll become a little delirious. She may do some traveling, and I'll explain what that is later. As I was saying this, she woke up again, and she said, "But who's going to pay my bills?" And at that moment, we all stood together in a circle, held hands, and we said, "Don't worry, it'll be okay. Everything will be taken care of." Ultimately, this is what her brother said, as God takes care of the trees, the bees, the animals, He'll take care of His children too. Just go peacefully. As he stood there just singing beautiful Hispanic Christian music, we tried to be present, and we prayed together. And it was interesting because she had deteriorated very, very drastically. And after some time, again, she woke up in her lucid state, and she said, "I hear knocking. Can I go?" As we were in a circle, we held hands and looked at each other, and I felt such a part of the family, and I looked at them, and we all started to cry, and we held each other really tightly and said, "All together, you can go." As hard as it was for them, it was such an amazing experience because they somehow embraced me as family, and we were able to help her go through this. As he continued to sing this beautiful Christian music in the background, She fell back asleep. Everybody whispered in her ear, "It's okay, you can go." After some time, we were laughing because we remembered how vibrant she was. She was always cracking jokes, always spunky. One person said in the room, her house is open to everybody and anybody. The other person said, she cared for her family so holistically, through massage, by cooking, by taking them to parks, what she did for work. She loved to dance. And I couldn't help but resist, but she made me, every day I'd come to work, she made me laugh, and she taught me how to give a good massage. So as we talked about how Miss AY is dying, and that she is going to leave, her body will still be there. But that legacy that they have created will forever be in their hearts. And the reason why that is because Miss AY is more than her body. She's someone deeper. She's someone deeper that you've connected to, because when she dies, when her body gives up, and the body's still going to be there, but something animating it has left. And so that's what you will eternally have a relationship with. As they felt consoled and with those words, she woke up again. And this was almost about 2 hours after, and she said, she started profusely crying as we were caressing her head, her forehead, and she said, "I love you all, thank you. Thank you for being here, thank you for caring for me. Please tell my children I love them. I'm ready to go." As everybody again went to say goodbye, whispering in her ears, I said, "Miss AY, it's been a pleasure caring for you. Thank you for allowing me to care." She embraced me, and at that moment I just couldn't let her go, and she couldn't let me go, and we just cried. And we cried because it was such an intimate connection. I was caring for not only her body, but someone deeper, something deeper. I was helping her get to another destination, helping her get to we call it the eternal care unit. So, this being said, as she tried to let go of me, she said, "When you see God, tell him I said thank you." And at that moment, I couldn't hold back my tears, and I said, and I didn't understand it at that very moment, but her sister heard what she said, and she said, "It's because you're an angel." And that time I really couldn't hold it, and I started to cry. But at that very moment, I just felt like I was caring for this person, this human being, this soul that was on its journey. And I thank the family for allowing me to be part of their journey, such an intimate journey, and for allowing me to serve them. So this being said, I don't feel like an angel every day, but they sure did make me feel like one. And sometimes we go through life and we feel, we may go through our certain routines, and it may get full of routines, but know that every single one of you have the power to change the world and hearts. That you are an instrument of love and compassion, and I truly felt it at that moment, and I wanted to share that with you. So if you can take your hands and put it on your hearts, if you can close your eyes, you can do some pranayama and take a few deep breaths. Inhale, lower belly, mid belly, chest. Exhale, chest, mid-belly, lower belly. Inhale, lower belly, mid-belly, chest, exhale, chest, mid-belly, lower belly. Take a few more deep breaths on your own. Whether you're nurses, physical therapists, chiropractors, doctors, yoga teachers, professors, spiritual warriors, we encounter people on a day-to-day basis in which we have the choice to be used as instruments of love, compassion, and grace to the people we come across. Feel blessed, as it's so important and so needed, never forgotten. And the way we can be these instruments is if we access it within our own hearts. Like Miss A.Y., we're more than our bodies. We're something that resides in our hearts. In Sanskrit, it's called the Atma, or the soul. And the nature of the soul is to be eternally happy, full of love, joy, bliss. Take a few more deep breaths. Connect with this. You may feel your heart beating. You may feel your chest rising. You have the power to be the instrument. I'm going to chant a mantra, which is a mantra that helps you get access to that innate love that's dormant within us. You don't have to chant with me, you can listen if you want to. Hare Krishna, Hare Krishna, 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 Hare, Hare, Hare Rama, Hare Rama, 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 Hare, Hare. 2 more deep breaths. On your second breath, bring your hands together, and we can end with an Om. Thank you for what you do.